What do we have here? What kind of critter is that?
So we have a ferret that's been depressed and lethargic for about 2 days. So the baby's heart rate's a little high and has a fever 104. So that is high for a ferret. So we're gonna check out the belly. The belly felt a little bit painful. We look like we might have lost some weight as well. So we're gonna see if she ate anything that may make her belly unhappy.
Huge.
Hi. So it was, yeah, I would do that. Let's go. My arm in the way.
Chili.
All right. Alright, so we'll start right side and then bring it down. Position. So we always want the head on the left and tail on the right. This really was a rather nice image. You did a really good job on it. So now let's kind of zoom in and look at some body parts. So head's this way, so we're looking at the trachea coming down. He said that the ferret was increasing its respiratory rates. So we do see that there are some increased opacity in these vessels in this area here. Heart, maybe slightly large. We'll have to look at that. The stomach is where it looks like we're getting interesting. If that's the border of the stomach is huge. All right. So it looks like there's a lot of debris in there, gas in there, and that does look like the stomach is enlarged. We gotta have to get other views to see if it's turned or twisted in an unusual way, but definitely that doesn't look right. Spleen sits here. Ferrets have normally large spleen in comparison to dogs and cats, so that's not okay. And I'm not liking how that looks. If she's been eating and having normal stool, I'm surprised that she's got so much gas in there. But inflammatory bowel disease is real common in these guys. Helicobacter is common, ulcers are common, and then eating foreign objects. But now that I look at it, I don't necessarily believe that this is a foreign body. The more I look at it, it would look the same as if it was a cat with a foreign body.
It'd be nice if he's going to eat something, he'd eat something that shows up on X-ray. Nick, what are some of the things that could be in his stomach that would not show up? You know, it might just be a mottled, fuzzy appearance like that. It could be food, it could be fluid, it could be...
fabrics, toys. I was just telling these guys earlier, I had a guy that ate a Nerf arrow. They don't unfortunately show up. They do eat hair bands. They can eat anything kind of plasticky. So fortunately a lot of these things might not show, but I do feel like there's some thickening to the bowel, so this may be a nasty inflammatory bowel case. So ulcers are very prominent in these guys with concurrent diseases or stress or surgery. So we usually do the antibiotics for the presumptive issue of Helicobacter, and then treat the inflammatory bowel disease with the steroids.
Oh, look at the ferret. He's gotten very cat-like. Is he he's under his blanket? This is how a normal, happy ferret hides at the vet clinic. We got a nice heat and pad in there for you, girl. Oh, you're in there? Are you in there? Let me see. Let me see. You hiding? You like to be snuggled up under your blankie. I'm sorry. You can go back to sleep.
I just have a question.
All right.
I'm from the Danville family vet in
Get
Danville,
some blood
Virginia.
from that leg, hopefully.
Trying to house.
I got a little drop. There we go.
Okay. All right. Thank you.
That's good stuff. That is good stuff. Yeah. Doctor brings some yummy food. Yes. The blood work is running, so hopefully we'll have an answer of that here soon too. We double check. But so far her sugar was good. And that's an excellent, excellent thing because insulinomas are so common in these guys. So we've got some good news, but we want to make sure that we can diagnose this down to the T as best as we can. Oh yes, and that fever, I'm sure she's very uncomfortable. Yeah, and then I'll keep poking you throughout the day and give you updates, okay?
What's in that magic cup?
It's called Ferret Crack. Some multivitamins that these guys love.
They just love it, huh?
Yes, and it
Got
keeps
her
them
belly.
calm.
Her belly all shaved.
Yep, she's getting an ultrasound today. Nothing abnormal with that adrenal.
She's getting the plum white treatment.
She is.
You treat just her white spots. No, she
I
gets the
usually
whole
just
thing.
put it all over.
You like your bath, Mapes? What do you say?
Maples.
Mm-hmm.
You say hi, May?
It's not that bad, is it? It'll make you really pop.
Yeah. She gets these yellow stains on her legs. And
Yeah. The plum white really works for that.
yeah, it really does.
You're pretty happy getting your hair cut. Yes, you're pretty happy. You're pretty cute. Yes, you are. You're pretty good. You're pretty cute.
She's very happy.
Mm-hmm. Another little white fluffy getting a haircut.
Got lots of white fluffies.
Mm-hmm.
Little fluffy guy.
What do you say, buddy?
He's supposed to lick it.
Is it all here, Sophie?
I hope so. I wish I could find the one that's got the invoice. Tell them from just looking at them.
Yeah.
They don't have to ultrasound or nothing. And so in those cases, they'll be obese, and then they'll stop eating, and they'll get depressed and lethargic. But she's not depressed and lethargic. Fatty liver disease also, like I was saying in the room, can happen with, or they can get fatty livers with follicular genesis.
Joey, what you doing?
Because it's more fun that way.
Oh, Mama, that smells like food.
She smells her food.
That's my
It
food.
says
That
that's
is her
my
food.
food.
How's she know?
She says I just like food. Hey, leave her alone. She doesn't want to visit with you. She doesn't feel good. Come here.
But everybody should visit with me.
Hey. Sit, sit.
I'm a happy
Good
puppy.
girl. Your butt came off the floor. That was not a very good sit. Leave her alone. Come here. Sit. Yeah, good pup. You need to go pee-pee? Huh? Mama, let's go, buddy. Doo-doo. That was a listen to Mom. That was
She's very
good.
smart. She's got her trained really well already.
Go outside.
Calling the family vet. How can I help you?
I feel like he's so dehydrated.
Hold on one second. Let me get my student on the line.
You comfy? Just a second. I'll try and see if they try a different pillowcase and then put it on the scale. Alright.
This is a rat snake.
Yep, so we just drew blood from the rat snake.
So how old?
They don't know, but if you notice, this guy actually has a kink right here, so he has what we call scoliosis in these guys.
Oh.
And he also had an infection called discospondylitis in his spine. So this guy was getting antibiotic therapy and was getting some pain meds. And we're just rechecking his blood work because he had some abnormal values that we want to make sure that are doing better.
We have got.
As you can see,
I
his
got
little
our
ripple there.
report, but we are
So that won't straighten out. He's got a little permanent kink there.
Yep.
that order
And he'd
number
actually had nerve
7,
deficits, so he actually had problems with the nerves in his tail. So he's
So the
improved.
kink
Our phone number here.
pinching off the nerves and all the way down on his tail.
But now he's doing absolutely wonderful,
He's got
and he's got
control of his
great
tail.
control.
Yeah.
So it's pretty awesome.
That's good. The treatment's working. So we're going to put him in the sack
And we're gonna weigh him.
because otherwise he wouldn't stay on the scale, would he?
No, he would not.
Got it in marketing.
All right, 1.6.
Two different vaccines here. This one is a multi-dose vial, so there's 10 milliliters in here. There's 10 doses of vaccine. And the way that we use this is we take our syringe and I will draw up 1 milliliter out of this vial for one patient. And then I will take that vial and put it back in the fridge and reuse it. Problem is I've already stuck a hole in here and potentially opened it to contamination. So this may stay in the fridge for who knows how long, and it's not the best way to practice. It is a perfectly legal and okay with the state of Virginia and the Department of Health Professions. But a better way is to have single-use vials. This has 1 milliliter, 1 dose for one patient. Take a sterile syringe, a sterile vaccine, I draw it up, and I throw them both away. That's the best way to practice.
So it's very common.
There's the...
What is it? What is it? He gets. Oh!
Oh, you saying it. You saying it. Oh, hello. You are... Oh, Boozy. It just smells bad. You can't eat it.